This is McCook's Mr. Bill. It's an honor to have you here. I don't know what it's like where you are, but here in McCook there's a lot of talk about the healthcare issue that's coming at us. You bet. Now we know that they messed up big time with the Obamacare. It's imploding on itself, absolutely. At the same time, there's a lot of people that get to use it for free, and they want to keep that free thing. So how do you cover it? How do you make things better for everyone? Well, you need some extra cash to take care of, and a policy that says that if you get some kind of catastrophic disease, that alone would cover it. Real simple. We've got hundreds of billions of dollars going to other nations in aid. That's taxpayer dollars. That needs to stay within the United States and work for the United States. Next, we have to get Canada and any other country that will sell us drugs cheaper than our own country to start working with them. Competition will drive down the price, absolutely. Next, profit. Everybody wants a profit, but 100% profit, that's doubling your money on a given product, pill, or treatment is all you should be able to make, 100%. Now think about that. Farmers, they are lucky to get 3 to 5% profit. And that's for putting food on your table so your belly button doesn't push up against your backbone. 100% maximum. Anything beyond that, there should be 100% tax on it. So they'll quit that. Absolutely. Now, let's talk about another way to bring in some money. And that is tobacco tax. Going to the schools mostly nowadays. We're going to take it away from the schools and put it into the medical community where it belongs. Because tobacco causes a lot of health issues. And of course, then you'd move on into alcohol. Those taxes should go for medical problems. Yeah. And now while we're talking about spending money, anyone here from another nation, not an American citizen, if they get sick and they or their employers can't pay for it, or whatever part they don't pay for, guess what? The nation they come from has to pay for it. Has to pay for it. Absolutely. Oh, and say, well, they won't pay for it. We can't make them. Really? Then we ban your people from coming to our country until that is paid off. Nothing about religion. It's about the dollars. And that's what this country has got to be. Absolutely. Another thing I'd like to see done is a 25-cent federal tax on gasoline. That means any police reported accident is 100% covered. You're being hauled to the hospital in an ambulance from a tragic accident with injuries, serious or what have you. The last thing you have to worry about is who's going to pay for it, because it's covered. The more you drive, yeah, the more tax you're going to pay, but the more chance you're going to get injured. And I think this is a wonderful way to solve that and to cut down the rest of the healthcare problem. You bet. Now, I cannot talk about healthcare without education. We spend way too much money on many subjects that simply are not utilized throughout the life of the children as they grow up and get into adulthood. They just aren't utilized. And so eliminating those educational studies and opening up a new one. And that would be some kind of basic EMT course, 4 years of it in high school. And that money spent and time spent would mean that throughout that child's life, they will be able to solve a lot of their simple medical problems themselves. And last, I'd like to talk about medicines and or treatments that are not yet allowed in this country. I believe they should be. If they are proven that they have worked in other countries, that they should be allowed into this country, as long as the patient signs a waiver of any responsibility until it becomes legal, saving massive amounts of money and bringing a lot more health to the patients of this country. This is just a few, but what are yours? And let's all work together for a healthcare program that the government, no matter Republicans or Democrats, are going to screw up unless we raise Cain.